Hi there, how are you? I hope you're well. In case we haven't met before, my name is Dr. Karen Trainer, and I'm a veterinary pathologist with Innovative Vet Path, and I specialize in derm path. I read cases for clients all over the country, and I really love derm path. So today I'm going to share with you a case, and it's going to be from a cat. It's a very classic lesion, and I'd like for you to, if you have any questions as we go through this, please post them in the comments below, and I'll follow up right after the rounds or as soon as possible. And so this case today is from an 11-year-old female spayed domestic short hair, and she presented, the photos are courtesy of Dr. Falk, and she presented with multifocal skin masses, skin lesions. You can see that there's this discoloration here on the paw. It's slightly elevated, a bit crusted. It's even opened up and ulcerated a little bit here. And there's also lesions on the chin as well, multifocal lesions here. And you can see that they're a bit erythemic here, and then some dark crusting around edges. Could be some acne as well. So we'll switch over to these slides. So when we look at low mag at the histopath, you can already tell there's going to be something good going on here. So what we have is a large raised plaque-like lesion, and we also have an area of infiltration as well. That's what we can see here at low power. And then if we go a bit closer, we can see that the epidermis is all thickened, and it's primarily an epidermal tumor, and then there is invasion into the underlying dermis as well. But if we look here, I'm going to rotate this so we can get our bearings. Some people like to look at a properly oriented slide. So as we go from the normal epidermis, we're cruising along, then you can see it starts to become thickened here and extending down into the follicular epithelium, and it becomes progressively thicker, and then things start looking even more odd as we get closer and closer towards the mass. And what happens here is we're starting to get mitotic activity slightly above the basal cell layer. We can see that the cells are starting to pile up, jumble up, and get very disorganized. So we're starting to see dyskeratosis. We have abnormal, we've lost that normal orderly maturation process, and cells become jumbled. But as we're cruising along, we see that these neoplastic cells are, some people refer to this as respecting the basement membrane. And we can identify that basement membrane, and it's intact. There is certainly inflammation here in the dermis. We have a mix of mast cells, we have some neutrophils, a hodgepodge, but we can start to see it's getting very expansive now as we move towards the center of the mass. And as we go even further, you can see it becomes infiltrative. We no longer have that clear, well-demarcated basement membrane delineation like we did earlier on, more at the margins of the lesion. As we progress towards the center, you can see it's lost that barrier and has now invaded into the dermis. So this lesion is called bohinoid squamous cell carcinoma, and when it respects the basement membrane, it's called bohinoid squamous cell carcinoma in situ or carcinoma in situ. There's a lot of different variations, permutations of the name. And it can progress, certainly, in more advanced lesions to become invasive squamous cell carcinoma. And that's what's happened with this particular lesion. We can see all of the mitotic figures. There's one here, here. You can see the cells are jumbled and getting very disorganized. So it's not uncommon for these to have quite a bit of dermal inflammation as well. And that can be quite variable. Sometimes you get some keratin pearl formation. So here we have a mix of mast cells, lymphocytes, plasma cells, and pigmentary incontinence. Remember how we saw some hyperpigmentation changes as well? That can happen. Sometimes these tumors can be melanized. So neoplastic cells, this is not uncommon with follicular tumors as well, and some sebaceous masses, especially when they occur on the eyelids, so meibomian tumors. You can see all of the mitotic figures. So melanized variants of this are possible as well. We can just see the swirling pattern. So there's lots of different changes to see, and there can be secondary infection with these. So oftentimes, remember, we saw perhaps some crusting in those clinical photos. So here we have a large accumulation of spherocellular crust and a mix of orthokeratotic, parakeratotic hyperkeratosis. We can see these accumulations of melanin pigment as well. And it's not uncommon for these to have some degree of bacterial infection. I've also seen these present with malassezia as well. So any number of permutations and presentations with this condition. So I just wanted to share this case with you because I thought it was a classic lesion, and it's a good one to be familiar with and to be aware of that if left for some time, it can go on and progress to infiltrative squamous cell carcinoma. This was kind of a nice example where you can see it going into that transition. So I hope that you enjoyed this, and I'll see you next time. All right.